Just want to welcome everybody to the KHAM webinar. And we've got a couple speakers today. We've just got a few more people coming in right now. Just give it a minute. Okay. Well, I'm Julie Haleska. I'm the webinar chair for KHAM for the education, and I really welcome you for coming today to spend some time with us learning about AB1020. And we've got a couple speakers. One is Alexandria Filatowski, and she's been with AllianceOne for 6 years as general counsel, and previously in the private practice litigating consumer clients' claims. And then we've got Terri Meier from UCSD, and Terri is the System Director for Patient Revenue Cycle, and she previously to that was at Stanford and Oregon Health Science University. And Terry's also our incoming president of the HFMA San Diego chapter. So I'm going to go ahead and turn it over to Terri, and then we're going to have comments in the chat. If you've got any questions, just go ahead and type those up, and we will answer them as we can. So thanks again, and go ahead, Terri.
Got to get off mute, I guess. Thanks, Julie. Thanks for the opportunity to kind of give you all a real world perspective of complying with AB 1020. As Julie said, my current role, I'm the System Director for Patient Revenue Cycle here at UC San Diego Health. So my department is a single billing office. We bill and provide the customer service for both the hospital and the medical group. So for our patients, it's a one-stop shop. I wanted to start out with, it's not moving. There we go. With the high points of AB 1020, the changes to the charity care, it increases the eligibility from 350% to 400% of the federal poverty level, and then changes the definition for high medical. So we can now consider the patient's current family income and not just looking back 12 months at their family income over the last 12 months. You know, with COVID, there's been so many changes in, you know, patients' financial stability at times, and we were glad to see that we could now consider that the current family income, and it's the lesser of. So I think it really helps the patients. There, let's see. Oh, that thing is not working. And then AB 532. This is the portion that is requiring those patients that are in the hospital to be provided an estimate of services that we reasonably expect them to pay, as well as a copy of our financial assistance form. So the hospital shall provide the person with a written estimate of the amount the hospital will require the person to pay for the healthcare services. So this is something I think we, you know, our financial counselors have done pretty consistently without the addition of the AB 532 for those patients that are actually in the hospital, and screening them for not only our charity care, but for Medi-Cal and other government programs that that patient may qualify for. Along with AB 1020, we're asked to provide the patient with a written notice of the availability of the hospital's charity care program. And part of that written notice needs to include the internet address for Health Consumer Alliance, and information regarding Covered California and Medi-Cal presumptive eligibility, as well as our webpage.
Yes, I'm in
So
a meeting. This is the only meeting I have today. What's up?
Let me see if I can mute him. Let's see, where was I at? The address, okay, for Cover California and the presumptive eligibility, as well as our web address for our estimator tool that was required by the federal government for the shoppable services. So what we did here at UCSD, you know, under 501R, we are required to have that plain language summary regarding our charity. So what we did was, instead of creating a new form, we just added a back page to our current plain language summary that was required by 501R, and added the Consumer Healthcare Alliance, the Covered California Hospital, the HPE, and here's our estimator tool, and our how to get our policies. We've got this also on our website, and it needs to be clearly displayed in locations that are visible to the public. And the big caveat here is the addition of having to provide it to the patient at the time of service. And then if that patient leaves your facility, needing to mail that that notification within 72 hours of them leaving the facility. So kind of how we crack that nut is, we're an Epic shop, and we added this notification to our documents table within registration, where our front end team members have to document that this notice was given to the patient, and the date, and then you know, it's stamped with their name. And so what we did as a hook, we are those patients that it has nothing has been documented in the documents table that this patient had received that notice. Then it's populating a work queue for us, and then we're automatically mailing a copy of that notification to the patient, so we can meet that 72-hour requirement. And then goodbye letter. I know a lot of people were struggling with this. This is a letter that is required to be given to the patient prior to assigning the account or selling the account to bad debt. I know here at UCSD we don't sell debt, but we do assign it to collection. And I think, you know, I look back, I've been in healthcare for about 4 years now, and I can remember, you know, like back in the 80s when we would, you know, give the patient, you know, their statements, and then we would send them a 10-day notice before we sent the account to collection. So I feel like I've gone back in time to that same process that we had oh so long ago. But there are particular attributes that need to be on the goodbye letter, such as the date that you gave the patient charity, date that you notified them of the availability of charity, a date that you mailed them a charity application, and a date in which the application, there was a determination on the application. It also requires you to name the entity that the bill is going to be assigned to, and information for the patient on how to request and obtain an itemized statement. So I was going to share a little bit about UCSD's goodbye letter. This is kind of what ours looks like. we have our dates up in here, notice of the availability of charity. We actually are taking our first statement date because on the back of our statements, we have all, it kind of looks like that 501R requirement with all the information for the patient with regards who should be eligible and where they can apply for charity. And then we are pulling our financial assistance application set date and determination date from some documentation that we enter into Epic. We let them know what balance is going to bad debt, the name of the agency in which the debt is being assigned, how they can obtain an itemized statement. We actually put our website, so if they want further information on charity, the back page of this letter is the instructions for how to fill out our charity application. And then this letter has one additional page front and back that actually has our actual charity care application attached to it. So changes to the debt collection, again, the bill would prohibit a debt collector or debt buyer for collecting the consumer debt that originated with the hospital without including in their first written communication to the debtor an actual copy of our goodbye letter. I know from an agency perspective, the notice has grown into multiple pages, and you just wonder how a patient can absorb all of this information. But they need to also attach a copy of our goodbye letter to their, it's, I guess, a Regulation F requirement with their first written communication to the debtor. That actually was a struggle for us a little bit. To get copies of our letters to our agencies. We ended up actually just providing them a copy of our letter file that we're sending to our print and mail vendor with an Excel file on how they can pull the letters that are associated with those accounts that we have assigned to them for bad debt. But that was definitely a challenge. Another change is debt collectors cannot report adverse information to a consumer reporting agency before 180 days after the initial bill. I know we don't report anything to agencies, and then with the new federal law about removing healthcare debt from their credit reports. I know I've actually heard of some agencies that are like they're just not reporting at all anymore, to comply with some of these new rules. But 180 days is the deadline there. Also have to remember, if we made a couple of adjustments to our charity policy, with the FPL and the definition for high medical. So copies of those policies need to be submitted to HCAA, and I think they used to be, that's the old OSHPD. So need to make sure that that those policies are out there on that website. I know in California, we've always had to, publish our CDM and our policies out there on OSHPD. So this is just making sure that you need to get those policies updated if you've made a significant change. And because the compliance, the enforcement on that is going to be starting on January 1st of 2024, where they're going to enforce provisions related to hospital charity and patient debt policies. And I think there's actually a pretty hefty administrative penalty for those hospitals that are not in compliance. So update your policies and get them out there posted to HCAA, formerly OSHPD. And that's kind of all I have.
All right. I'm going to turn it over to Alexandra before we take questions. She's in here. Alexandra, are you in here? Oh, by the way, I wanted to let everyone know that we're going to get a copy of Terry's deck, and we'll have it on our website for you to download.
Okay.
And I got my email on there too, Julian. If I could be of any assistance to anybody, please don't hesitate to reach out, and
Great.
I'm happy to share anything that we've learned along the way if it'll help you.
Excellent.
Okay, so I'm Alexandra Filatoski with AllianceOne, and I'm the general counsel. And I just want to reemphasize the importance of what Terry mentioned towards the end of the presentation, which is that goodbye letter is really critical for the agency to have as an enclosure with our initial notice to the consumer. If we don't have that, then we're not in compliance with the federal regulations that govern us, and we can be subject to great exposure. And I understand that it was kind of an issue in the past, but hopefully there can be a way to figure out how to smoothly, when you refer an account to a collection agency, we're not a debt buyer, we collect third party, that you can attach those goodbye letters.
Excellent. Thank you. Now, we'd like to open up the chat for questions for Terry or Alexandria. If anyone has any questions, let me see if I can look at my view a little better. Any questions for anyone today? I know that was a lot of information, and it's all relatively new and can be confusing at times. Does anyone have any questions? No questions? Well, I will leave it at that. You've all learned a lot today. And as I said, we're going to have a copy of the presentation on our website. Terry's available. She's a great resource for HFMA as well. And she definitely has said that she would help us out at KHAM too. So we really appreciate both of you being on the call today. And I'm going to give you back time in your day so you can go have some lunch. And thanks everyone for joining us today. And I hope everyone has a great day. Thank you so much, everyone.
Thank you.